Connecticut's Back to School Authority is sponsored by Yale New Haven Children's Hospital, one of the best in the nation.
For many parents and caregivers, the decision to send kids back into the classroom has been a difficult one. And for many students, all of the changes have resulted in feeling more isolated. Channel 3's Caitlin Francis explains.
And when I ask, when did the change start? When did you notice this, difference in your child? They seem to always link it back to when COVID hit during the pandemic. These are phrases I hear: social distancing, quarantine. It happened during the quarantine.
Dr. Vicki Smetak says that change she's seeing at Yale New Haven Children's Hospital is a drastic increase in behavioral health visits. She says children as young as 7 or 8 are showing up with anxiety and depression, and they're calling it COVID isolation.
There's so much that as adults we can do to help them. I think, first of all, recognizing that this is not normal for kids. That again, their tendency is to make connections and be with each other. So just first and foremost, talking to them, acknowledging that this is different, why it's happening. I think those conversations are really important.
She says parents and educators need to understand the developmental difference between a younger child and a teenager. Their needs are different socially. Younger kids will rely more heavily on parents and teachers in addition to their friends, where teens might just need more time with peers. But during these times, technology has to play an important role.
I can personally vouch for how important FaceTime and social media have been during this very stressful time. It can be a good surrogate to face-to-face interactions, and it does keep them connected with their peers.
Dr. Smetak says adults should be aware of small changes with children. Any signs of withdrawal could be a call for help and a good place to start a conversation.
Absolutely connecting with their pediatrician, behavioral health specialist, if that child is already in therapy, just alerting that support team around that child that there's an issue is so critical, and early is best. There should be no stigma attached to making those connections and reaching out, because it really will prevent further spiraling.
She's posted town halls and panel discussions through Yale New Haven Children's Hospital on going back to school and supporting children during the pandemic. I'm Caitlin Francis, Channel 3 Eyewitness News.